Good afternoon, and thank you for joining us for this virtual news conference about measles. My name is Christine Messenger, and I'm with the DHHS Communications Group. Today, we are joined by our Humboldt County Health Officer, Dr. Candy Stockton. On May 10th, DHHS issued a news release alerting the community to potential measles exposure after an infected individual traveling through Humboldt County visited a local hotel and an emergency department. Over the course of the next week, public health staff were in contact with more than 100 individuals who were potentially exposed to the virus. Through interviews, vaccine records, and in some cases, immunity testing, it was determined that the majority of those who were known to have been exposed were likely immune to measles. Additionally, 10 individuals were given the post-exposure prophylaxis vaccine, which can be given up to 72 hours after exposure. Well, we don't have any new information to report. Because of the interest by local media, we thought it made sense to get us all together and answer your questions. So we'll have everyone ask a question with a follow-up, and we'll start with Sage.
Yeah, that sounds good. I was wondering if it's known that what percentage of the peoples that were exposed were like unvaccinated or what their vaccine status was?
So we haven't calculated those numbers specifically for Humboldt County, but I can tell you that many people don't know their vaccine status anymore. They don't have their vaccines records readily available. However, the vast majority of individuals, we were able to actually trace their individual vaccination records or previous immunity testing or get current immunity testing. So the vast majority of individuals who were exposed were over the age of 30, and the vast majority of them were vaccinated or had other evidence of immunity.
I was also wondering how many people were exposed in the hotel versus the hospital?
There were 115 total exposures, of which nearly half of those were healthcare workers in some capacity or another. And so the vast majority of exposures took place in the emergency department as opposed to the hotel. As you can imagine, there's a lot more people in a hospital at any given time than there are in common areas in a hotel.
Thanks, Sage. Jacqueline, did you want to ask any questions?
I don't have a question at this moment. Thank you.
Okay, thank you. Rudy?
Sorry, I guess my question is, what has been the latest update to this case? If there's been any new updates lately?
Sure. So I can say that as of an hour ago, we located the 115th individual. So we have actually managed to contact trace every single individual that we're aware of that was potentially exposed, and are waiting for the results of their testing to come back at this point. But we have, that is our latest update, is we have identified every single person who can be identified as having been in contact or potential contact with our reference case.
One more question. Has there been any shoot, I forgot the question. I'm so sorry.
That's all right.
That's okay. We can come back to you at the end.
Of course.
Lauren, I know you have questions.
Yeah, absolutely. Thank you so much. And thank you, Dr. Stockton. Can you share a little insight into the contact tracing process? I know we kind of had a look behind the scenes during COVID. How was this different? Was this coordinated with the state? Are the 115 in Humboldt alone, or is this from San Francisco Airport to St. Joe's? Again, if you could just share a little insight into that process.
Sure. So actually, county health departments are responsible for tracking those individuals who reside within their county. So if we had had exposures, people say passing through the area that aren't residents of Humboldt County, we would, under normal circumstances, have passed those off to other counties and we wouldn't have counted them. We did actually include one individual who is not a resident of Humboldt County that came in contact and was passing through, because we were able to reach them within that 72-hour window period where they could still get post-exposure prophylaxis if it was needed. So, and this happened obviously, as most of these things do, on a weekend. So we actually did track one individual that we would normally have passed off to another county, but the other 114 were Humboldt County residents.
Thank you. And just for quick clarification, so it's my understanding that out of the 115, it is believed none of which have contracted measles.
Yeah, at this point, none of them have contracted measles. We are still in the potential window period for developing measles until about 6:30 a.m. on the 31st of this month. So we continue to monitor individuals, and we're working with local healthcare facilities to educate them about what to look for and what to do if somebody presents with a concern for possible measles. But at this point, we have not seen any cases. And while we can't guarantee we won't, we do feel pretty confident that we've identified essentially everybody exposed and are monitoring pretty closely.
Thank you, Dr. Stockton.
Skylar, do you have a question?
Most of my questions have pretty much been answered. I guess 115 cases, so there's no possible, or sorry, no really fear of like a surge really up in Humboldt County, correct?
You know, I think that all of us have learned to not to say there's no possibility of something. The likelihood is very low. Again, we're very fortunate that most of those individuals who were exposed were over the age of 30, which is before a lot of the anti-MMR vaccine misinformation that's circulating really started to come into play. So the vast majority of individuals were actually vaccinated. Had this happened in a school setting or a place where there are a lot of young individuals, that might have been very different, but we're very fortunate that that wasn't the case with our exposures. And while I can never promise or guarantee that we won't see cases, the odds are in our favor that this will not become an actual outbreak, that we just had what we would consider what's called a large-scale exposure event, where a large number of people were exposed, but we're not expecting to see resultant cases from this.
Awesome, thank you.
I do have one question. Sorry to interrupt.
That's okay.
At what point would it become an outbreak if it ever gets to that point?
Yeah, that's a great question. So an outbreak actually is defined as 3 linked cases. So if there were 2 additional cases that were to develop during the monitoring period, or one person who got measles from this exposure and then a second person who got measles from that person, that's what it would take to be considered an outbreak. So not very many cases, only 3, but we're not expecting that.
Sage, did you have another question?
Yeah, I was wondering how many of the exposures were children. It sounds like most of them were over the age of 30, so adults. So
Yeah.
but I was wondering how many more children.
Fewer than 5. And when the numbers drop below 5, we don't actually disclose the individual numbers, but it was fewer than 5 children were exposed, or minors were exposed.
Does anyone else have questions? Jacqueline?
Yeah, so have you asked people to follow certain safety protocols who were exposed? And I'm wondering how that might impact the healthcare workers who were exposed and their ability to do work.
Yeah. So what I can tell you are kind of the different classifications of what responses we would have in certain situations. So if you're a healthcare worker, you have to have documentation of 2 MMR vaccines or a blood test, titer test, as we call them, that shows immunity on file to be able to continue working. If you cannot produce those records within a 5-day period after your exposure, then you would be excluded from the work site from day 5 after your exposure to day 21 after your exposure, the entire time that there is the potential for you to become contagious. So that's how we would handle that if there was a healthcare worker that did not have adequate records of vaccination or immunity that was exposed. There are, there's also a category of individuals who are not healthcare workers, but are in high risk settings So for instance, and again, these are not specific cases for us, just examples of what those settings would be. If you worked in a daycare with young children, if you were a home health aide, if you work in a jail or another residential setting, they would follow more or less the same guidelines. They would have to have that evidence of protection or be excluded from those settings for that day 5 through day 21 period. And then there are individuals who are exposed to have compromised immune systems for a variety of reasons. And those individuals who have severely compromised immune systems, even if they have an adequate history of vaccination in the past, their immune systems may not be able to fight off measles. And so they're at risk of getting measles themselves and at risk of spreading it to other individuals. And with those individuals, we practice what's called a 14-day exclusion period, where they're excluded from high-risk settings under normal circumstances. So different from a quarantine, they're not required to isolate, but they are required to avoid high-risk situations. And if that were to happen for somebody, we would need to make special medical accommodations for them to receive any ongoing medical care that they needed during that period between day 7 in their case, not day 5 like healthcare workers, between day 7 and day 21 to help protect the community as a whole against risk of exposure.
Okay, thank you.
So that's how we would handle those different exposures. And for everybody else who's low risk, healthy, not immunocompromised, we can accept evidence of documentation of vaccine records or titers. And then there's also categories of people that fall under what we consider presumed immunity. So that would be, examples of that would be individuals who had served in the military because they're very aggressive about vaccinating, individuals who were born prior to 1957. Prior to that, measles was widely circulating and pretty much everybody before that time actually got measles. And so they tend to have immunity based on previous exposure. And then there's a couple of other categories, but those are probably the simplest, most straightforward to explain. So if you're not a high-risk individual and you're not a worker in a high-risk setting, we can use presumptive immunity to actually clear those individuals.
Okay, thank you.
Yeah.
Lauren, did you have any other questions?
Yeah, thank you. So it's my understanding that the man in this case was unvaccinated. Can you confirm that and share details on why health officials say vaccination is critical to prevent spread?
Sure. Well, so again, in a very small community, we don't share in details of individual cases. I will say in this case that this individual was originally diagnosed in another county, and the initial investigation into the circumstances was done by another county. So I actually do not know the vaccination status of the individual involved in this case because that investigation was handled by a different county. But what I can say is that in 2024 in the United States, there have been 139 cases of measles, and 82% of those cases were in individuals who were unvaccinated or in whom their immunity status was unknown. And only 6% of those cases occurred in people who had received 2 MMR vaccines, which is the current recommendation. I don't know, we don't know the information, the health history of those individuals, whether those were all people who were immunosuppressed, and so even though they were vaccinated, they weren't able to mount a response. We do know that the vaccine, when you receive 2 doses, is 97% effective in preventing measles, but that means that if you took 100 people who'd been vaccinated and stuck them in the room with somebody who had measles, the likelihood is that somewhere between 2 and 3 of them could develop measles from that exposure for any number of factors. Maybe they didn't build very good immunity against the vaccine initially, or from the vaccine initially. Maybe they didn't maybe they lost that immunity over time for some reason, or maybe they're now immunosuppressed in a way that keeps them from being able to use their vaccine-induced immunity to mount a response to the measles virus. But I mean, that is why you want to be vaccinated, is that it is 97% effective at preventing measles, and measles can have some fairly serious health complications, in addition to just being aggressively contagious and requiring absence from school or work or other situations for the time that you're sick with it.
Yeah, on humboldtgov.org under civic alerts, it stated that the man was unvaccinated. So I just wanted to confirm that. But going back to the contact tracing, it's our understanding that this individual traveled, outside of the country, landed at San Francisco International Airport. I know contact tracing, you're saying, is done by counties, but when we see, multi-countries, many different flights, airports, etc., how is that contact tracing conducted? When you go to airports, it's all very fluid and lots of people, moving all over the place. So I'm wondering if you could share insight into that.
Yeah, so I was not involved in that piece of contact tracing. And to clarify, we don't believe that our case is the case that traveled through the San Francisco airport. The dates don't align for that. So again, I was not involved in that case, but we don't believe this is the same individual. Having said that, obviously airlines are one of the most regulated travel methods in the world. And so we do have access in those situations to individuals who were on the same flight, as well as individuals who are on other flights, because only individuals who are ticketed and or are employees of the airline are allowed behind the security gates. We actually have fairly good access to records of who could have been in that area in a time. They can use those to narrow down and figure out who they need to contact directly, as well as posting media alerts and other information sources to try to reach out to other people who say your flight arrived in Terminal 2, but you actually walked over to Terminal 3 behind the security gates because you wanted to get food at a restaurant there or something. You wouldn't necessarily show up on our list of people that arrived in Terminal 2, but by posting that information publicly, such as we did with the location and times that we believed individuals could have been exposed, you do have people respond that way as well. So a certain amount based on identifying individuals at highest level of risk, and a certain amount of media outreach and other public outreach to identify people who could have snuck into the area in question that you're not aware were there.
Just to clarify, Lauren, I see what you're talking about. That's actually a news release from 2014.
Got it.
Yeah, so that's unrelated to this.
Thank you.
Sage, do you have another?
I was wondering, can you share like what county the person came from, and then I assume they left Humboldt County afterwards? Is that?
To the best of our knowledge, they did leave Humboldt County. And again, we don't typically share information about individual cases. If you're in a large urban area, sharing a detail like, location of origin or age or gender is not very identifiable with populations of millions. In our small community with small populations, sharing any single individual demographic factor starts putting that person at risk for identification. And just like you would want us to be respectful of your private information, we try to be respectful of all of our residents and visitors' private information. And we only break that trust to the absolute extent that it's necessary to help protect the public welfare.
And then one last question: is public health concerned about low vaccination rates in Humboldt County related to this outbreak?
As unrelated to this outbreak, public health is always concerned about lowering rates of vaccination. And I'm sympathetic to this. So I went through medical school in the late 90s. And I can tell you that I never saw a case of measles. In my training, in my residency program, in the first 20 years of practice, And most of my attendings had never seen a case of measles. And in fact, in the year 2000, we considered that measles had essentially been eradicated in the US, meaning that any cases that we did see were sporadic cases that were brought back when they were obtained from travel abroad. When your vaccination rates start to drop, those diseases start to show up again. And so we're always concerned about lower vaccination rates. To be honest, any single person who gets a disease, one of these communicable diseases, is unlikely to have a particularly high risk of having a serious complication from it. But when you start talking about hundreds or thousands of people getting the disease, you start talking about 3s or 4s or 5s or 6s of people having these serious long-term complications, and even with some of these diseases, the risk of death. And so it's not that, you know, for you as a single person, your risk from the disease is so terrible, but our children, our neighbors' children, our pregnant family members, our elderly family members, our next door neighbors, like together as a community, preventing the spread of these illnesses are how we take care of each other. And so it's understandable that in this day and age where many of us are not used to seeing these diseases, that the perceived risk of a vaccine can seem kind of scary. But the only reason we're in this situation where we can think the vaccine seems kind of scary is because vaccines have been so effective at preventing these diseases. And so we no longer have pediatric hospital units full of children that are, you know, permanently damaged and or dying from these vaccine preventable illnesses. In the old days, the idea that we'd be afraid of a vaccine was almost unthinkable because we had all watched our friends, our family, our neighbors, our children be injured and die from these diseases. And with the success of the vaccines, we've knocked those diseases down to a point that they don't seem scary to us anymore because we don't see them. But when we stop vaccinating, we start seeing again. And so I would love for us to learn from history and not have to learn from our own painful experience of watching our community members suffer from these diseases.
We have time for one more question. Skylar?
Yes, it's kind of a two-parter. Just because the measles symptoms, it seems like, you know, fever, dry cough, runny nose, kind of like a lot of other viruses or, you know, illnesses. You know, how should people go about if they do have some of the symptoms of measles? What's like the point where they should be like, oh, I should go get this checked out? And also, just as a fresh reminder, how often should somebody get a measles vaccination?
Great. So I'm going to start like backwards with that. So measles vaccinations we recommend a 2-dose series, and we usually administer the first dose between the ages of 12 and 15 months, and the second dose between 4 and 6 years old. Adults and teens, older children who have not been vaccinated for some reason, or who are not sure of their vaccine status and can't find records anymore at this point, can get those 2 vaccines separated by 28 days. So it's not that they have to be separated by years. It's just that that's the age range that we typically vaccinate young children. But for anybody older, for adults, who are not high-risk individuals themselves and are not healthcare workers, we usually will say that 1 dose in adulthood is considered sufficient protection at this point. If you are going to be traveling internationally, this is definitely one of the things that you want to check on, because there are outbreaks around the world in various countries right now, and that's in developed countries and third world countries, so it doesn't really matter where you're going. If you're going to be traveling with your infant who's between the ages of 6 and 11 months old, is not 12 months old yet, we can actually give 1 dose of MMR early between that 6 and 11 month time period to help protect that child while you travel. They will still need their 2 doses once they hit 12 months, but giving that first dose early will provide some protection. And if you have a child that is older than 12 months, say between 12 months and 4 years, where we typically give the second dose, You can give a second dose to that 1 to 4-year-old as long as it's more than 28 days after their last dose, to try and get that extra level of protection before you travel internationally. So really important to be doing that. And a lot of people are not aware of that because this resurgence in measles internationally has been relatively recent. And so it's not something we've talked about a lot in the past. So that's the answer to your question about when to get vaccinated. And I apologize, I forgot the first half of the question.
Just because the symptoms are kind of similar, just when should somebody get checked out?
Great, yeah. So in general, measles is going to be the least likely cause of any cough, stuffy nose, runny nose, pink eye, conjunctivitis type of thing that you might see. That we wouldn't recommend that you start seeing or thinking measles when that happens, unless you've had a known exposure or you've traveled outside the country to somewhere where there's current cases. So we would not recommend that everybody who develops that in the next few days, immediately rush into their doctor. However, the rash for measles is fairly typical. So measles covers or measles tends to present as a low-grade fever, cough and cold symptoms, and then a couple days later as a rash, which usually, but not always, starts at the top and works its way down. It tends to be a red polka dotted rash, although in people with a little bit darker skin color, that can be less obviously red. But that combination of factors, those cold symptoms followed by a unique rash developing, if you were to have that, there are still dozens of other viruses that can cause something similar to that. But at that point, you should call and check in with your healthcare provider to go through some questions over the phone to see if you might be higher risk and should be tested for measles or some other illness. And if you don't have a healthcare provider, then you should call public health. And that number is, for our communicable disease who's watching for this over the next several weeks, is 707-268-2181, and that will take you to somebody who can screen you. We ask that if you are developing symptoms that you think might be measles, please do not go into a healthcare facility unless you are so sick you need immediate medical support, because we don't want to risk that spreading to other individuals, particularly in a healthcare setting, other individuals who might be immunocompromised and may not be able to fight off the virus if they are exposed to it. And that does remind me of a plug that I did want to give. In addition to my really amazing communicable disease team who worked their heinies off, actually contacting and finding all 115 individuals who were exposed and working to verify their vaccine status and get them testing or vaccines if they needed them. We also have another really great benefit locally. So unlike many rural communities, we have a public health lab that is capable of doing PCR testing for the measles virus, which means that we don't have to send those samples out, wait a couple days for them to get to a lab somewhere, get tested, and get the results back to us. Our own public health lab is able to run those tests and confirm whether it's measles or not. And we can get that test turnaround time generally the same business day, but within 24 hours if we're responding to an emergency. And so we're very fortunate to have that asset locally. So we'd be much less prepared to respond to exposures and prevent outbreaks if we didn't have the capacity to test locally.
And then we just have one last question in the chat, and that is just asking if you can talk about the vaccination rate of Humboldt County residents.
And I'm sorry, I'm not prepared with those numbers today. We can follow up on that and get them back to you. It varies depending on which age group that you're talking about. And it's not really accessible for any age group other than sort of an estimate of school-age children, but we can follow up with the specific numbers that we do have.
That sounds great. Well, thank you, Dr. Stockton. Thank you, media folks. It's always good to see you.